All right, we are now joined by Rich Sicina, Health and Allied Workers, Indaba Trade Union President. A very warm welcome to you, Rich. Always a pleasure to see you. Thanks for being with us.
Thank you very much, Sis Flo, for having us. Good evening to you, team, and the viewers at home.
All right, Rich, talk to us then. I mean, it's really quite scathing and an indictment really on, nurses in general and, health workers in general when patients complain of, and as they put it, appalling staff attitude. I mean, what do you say to that? How do you respond to that as someone who's, proud, I would assume, to be a health worker yourself?
Sis Flo, let me just not hold back and say it like it is. I don't want to lie. There is the negative attitude out there. It exists. Like the so-called root healthcare workers, nurses in particular, they do exist. Sis Flo, I don't want to lie. We work with them. I usually say they are not only rude to patients, our colleagues. They are rude to us. Like, now as I speak here, there's no nurse or doctor or any healthcare worker who will tell me that they don't think of one of their colleagues as we speak. I have one in mind, few of them that I've worked with before, and I'm working with them currently to say, if that one, I usually say they are not tailor-made to be nurses, because nursing is a sacred profession. You need to be spiritually strong here, emotionally strong and mentally strong, more especially in the context of our country where public sector is neglected. You need to be really strong so that you'll understand that you have to displace your anger to those in positions of authority, government, management, and anyone in a position of authority, instead of displaying your anger to patients who actually don't know whether you do have medication or you don't have medication. There is a lot of things that make that turn nurses into what they are today. I usually say sometimes nursing is like money, Mrs. Flo. It doesn't change who you are, but it reveals your character.
Yeah, I mean, Rich, and to that point that you're making, I would think that many of the nurses, maybe I'm being a little bit too optimistic, but I would assume that people who go into nursing oftentimes go in with the right attitude, go in with the right heart, but something happens, while in the industry that turns them. You used the word turn. What is that? And I think many times you've come on air and mentioned, some of the difficult conditions that people work under. And I mean, it's not justification for people to turn, for nurses or doctors to turn on patients. But surely there is something that's making them turn. Let's talk to that.
You know what, as health and allied workers in Indaba Trade Union, we always say behind every behavior, there is a reason. Number one, in as far as transformation of our healthcare sector is concerned, management or those in positions of authority are useless. I usually put it bluntly like that. They are useless when it comes to transformation of this country, and there's gross shortage of staff, Mrs. Flo. When a nurse in a clinic is going to see more than 50 people, it's not normal. The situation is completely abnormal. Even when you move out of these healthcare facilities, CSE clinics as well, and you go into the facilities, into hospitals, you find us working. We are only 3 on duty, and we are nursing 36 sick patients. All of them are dependent. There's a lot of things that are happening here. And besides that, besides gross shortage of staff and gross shortage of material resources, Sis Flo, we go as far as going to the pharmacist to buy our own things, our own thermometers, our own PP machines. It's crazy stuff. You go to other clinics, we take our own cars and go to other facilities to borrow basic stuff, to borrow bandages, to borrow bactigras, the material or the stuff we use to clean and dress wounds in the ward. It's a crazy. You have to be spiritual to understand this and never bend and crack under these circumstances. And there are nurses who have been in the system more than 10 years, more than 30 years, more than 15 years, some of them. And the system actually provides an opportunity for those particular nurses to go to school and develop themselves, because all of us, when we come into the system, we want to be like me, to have these epaulets and stuff like that, and be a professional nurse and do a post-basic after that. And managers in particular, they actually deny these particular nurses an opportunity to go to school. They use these opportunities to score their stupid scores. So that builds anger in us as nurses, in some of nurses, and then they will just don't care. I usually say they are turned into employees. They will have an employee mentality. You go there to just work. You do what you can. What you can't do, you don't care. You are not protecting the system. We are also not protecting the profession at large, because we are angry.
What channels are you using, as a trade union president, to address some of these many challenges? And while you're speaking, I'm also thinking that maybe there's a need for therapy. Maybe some of these nurses and some of these healthcare workers are not only overworked, but also just overwhelmed emotionally. Isn't that also perhaps something to be looked into, that perhaps needs to be offered to some of the healthcare workers?
It's indeed. It is supposed to be there. There's no debriefing. I usually say sometimes, where I'm working currently at Grace Hospital in Pietermaritzburg, you'll have a patient will die in the morning. And when that particular patient dies, obviously we'll run around resuscitating and trying to bring the patient back and give that particular patient a second chance at life, but you fail. You are not. No one is going to come to you and talk to you to say, we know you are doing, you are trying your best and stuff like that. Life must continue, sister. Life must continue, and you need to go and smile. It's abnormal. You can't. Sometimes you lose 2 patients at a go. I usually make an example. There is a moment where we actually, before 10 o'clock, a doctor had certified that about 5 people in a medical institution, in a medical ward. That it's not normal when you are going to experience that, and life goes on. And at the moment, you are also getting poverty level salaries. I call it a one-day tournament salary. You are expected to work for 5 nurses. You are 1. You are expected to work for 5 nurses, and you are broke on that particular day, even though you got paid on the 15th. Then how do we then address such issues? Obviously, as an organization, Health and Allied Workers, Indaba Trade Union, we are still outside the bargaining council. Ours is to stage marches, is to encourage our nurses to write these grievances. You know what? Even I've been working where I'm working currently for 5 months, but I've submitted about 3 grievances. These grievances are talking to gross shortage of staff, are talking to gross shortage of material resources. Do you know what the management does? They use what I call it, they lead by ignorance. They will ignore those particular grievances. You will write those grievances, submit them, trying to say, guys, come on, management, let's fix our healthcare system. They will literally ignore them. They will never call a grievance set down. You need to be persistent. You need the resilience of the highest order and push those. Obviously, you will be labeled very bad. Eventually, they're going to crack.
All right, Rich, very sad state of affairs. Thank you very much for speaking to us so truthfully about the situation and not denying the current state of affairs at hospitals and clinics. That is Rich Sicina from the Health and Allied Workers Indaba Trade Union. He's the president of the union, responding to some patients. They're complaining of a appalling staff attitude at some of the clinics.